constraints there. So I think that's kind of like where you could potentially jump in.
Yeah, we could talk about like the school dental clinic that's more reasonable costs and that sort of thing.
For sure, yeah, like free clinics, things like that.
Yeah, that sort of thing.
Okay, and then I guess like from like a medication point of view, I think like one of the biggest things is like her BMI, like her obesity. So that's something that needs to be addressed. It's kind of affecting a lot of her other chronic health conditions. So yeah, because there's like the, you know, so there's like her blood pressure control's a little off, her diabetes. Her diabetes was okay, but we can still educate on that a little bit. And then in general, since the pandemic, it says that her BMI has increased almost 10 points, which is a pretty significant increase.
Yeah.
It says that she's been trying to like eat healthier, things like that, but we can just provide recommendations there, lack of motivation to exercise and that sort of thing. So we can talk about that. And then I know that also connects to her being able to get her left knee surgery because of her osteoarthritis. I guess that's been affecting her for a while now, and she can't get the surgery unless she loses, I think it was like 25 pounds or something. So I think that's like pretty high on the list to address.
I was gonna also say that with her health restrictions as well, she said, I mentioned in the case study that she's trying to, I guess, stick on some type of diet, but it's been hard with financial restraints. So I think definitely finding ways to be able to offer her nutritional resources that are within her budget as well, and offer anything that's maybe she doesn't have access to. So I can definitely look into that and ask her about that.
For sure. I think access and cost for the gym too. I think that was her concern with exercise as well.
Yeah.
And maybe screen for depression. I don't know if she.
Yeah, I was gonna also say that with her mental health struggles, I want to ask, like, you know, is it just during the pandemic? Was it before? Or, you know, is there something that happened within the pandemic that caused the onset of the depression, or even maybe the withdrawal symptoms? She said that she's disengaged from the typical things that she does, as well as it seems that there's a little bit of strain on her relationship with her husband. I'm not sure though with the support system. I want to kind of ask, what's the relationship right now? How would she label that? So maybe having some type of company would help. So with the gym, for instance, maybe if there's some type of support group that they can engage in activity, so that way she can also gain companionship and so on. So those are some suggestions I was thinking about.
Yeah, that's all. I think that's all great to address. And also something you can say about the exercise, because I know that's just something we've recommended to patients in the past, is you could tell them like if you know there's a lot of like exercise regimens that are for free online, and that's what people did during the pandemic who couldn't afford a gym membership. So you can also recommend just, you know, if they have access to the internet, being able to like watch free videos and things like that, you know, or like going outside and like just walking for 30 minutes every morning, like just kind of starting with like the basics and then you know, kind of addressing it from there. Yeah, I think those are all like the main things. I think so. Like you guys see where like the there's like the 5 concerns.
Yeah.
Rank them. So I think we just have to like put them in order of like what's most important. So what do you guys think is like the number one thing first we should talk about?
I feel like the fall is like pretty drastic, and like the teeth concerns maybe that came with the fall, because that was kind of like a sudden, like it's acute basically. So maybe be more at the top.
Yeah, for sure. I kind of looked sorry, I looked at like the fall and I saw like there was like everything was fine, like there was no fractures or anything like that. But I know that like she was like really just mentioning like the worsening jaw pain. So I don't know if that's like.
Yeah. So she did mention that they got X-rays of the jaw and the head, but they didn't take a X-ray of the tooth. So you have to see if the tooth's fractured itself. So that she probably needs X-rays for that. So.
All right, I'll go ahead.
We can put that as number 1.
The teeth, like the teeth related things.
Yeah, I mean, I guess Unless we put like BMI and then that is number 2.
Yeah, initially I put obesity first and then periodontal status, but I mean,
Yeah,
We
that
can
works.
that's fine.
Yeah, that's
we can
good.
go into like, because that's the, yeah, that makes sense. But that one's causing pain, so maybe put that one first because it's like
Yeah,
pain
that's-
first.
Yeah,
That's
I
true.
don't
yeah.
know.
That's
Because I'm
true.
gonna also like
it's especially if
talk
it's been
about,
more recent. Like for instance, we can put number 3 or 4 the maybe bringing up potential mental health struggles into support systems. That's something I really want to address as well. So,
yeah.
but definitely if it's more recent, such as her fall, and if she's already been facing some dental issues and pain, and then the fall just kind of like increased that pain, then it's definitely something that needs to be addressed before it gets worsened.
yeah,
I'm gonna put
and we can like tie in like I have oral hygiene education and diet counseling, so then you can tie in diet counseling like obesity, and then you can tie in like her like mental health to like her ability to take care of her teeth and her ability to go to the dentist and her ability to like do sorts of things. So you can tie those things in too. Because if she's not like she's not seeing the dentist regularly and she's just in constant pain, she probably isn't in a very happy state or her mood's probably affected by that. So
all right, and then okay, so I put periodontal status and obesity. Then, should we put disengagement and like the difficulty falling asleep and all those mental health issues? Malak, did you say number 3? Okay.
Yeah, 3 or 4, if depending if, like I said, if the pain and the symptoms or in terms of health are more recent, then we can speak about that first. But then we still need to address those as well. So she also mentioned she has kids. I'm gonna I'll just put that on the side. You don't have to put that down. Kind of see where her relationship with her kids are as well. Like, does she engage with them? Do they engage with her and so on?
Okay, cool. And then there was like the more, I guess, like minor things on the bottom, like her blood pressure control. Like it's not terrible, but she's been missing about 3 to 4 doses per month, and it's still her blood pressure readings are still a little bit high. And then also her, I don't know if you noticed, like her LDLs were pretty high, and then her triglycerides were also high, and then her HDL was low. So I was going to address the high cholesterol at the end.
Yeah, I think hypertension control and her diabetes is like not well controlled. I think A1C of 7.8 is too high.
Okay, so hypertension. I guess we can kind of put that together.
Yeah.
Control, and then high cholesterol will be 5.
Okay.
Is that cool?
Yeah.
Okay, cool. And then last thing, because we can add on to this later and like with the recommendations and stuff. The bottom part is like role and responsibility, like just the way we're gonna do it. So I wrote this out just generically. So like just tell me what you guys want me to add here. So I just started off with medicine and I said, and anybody can, if anybody wants to start the visit, you're more than welcome. I just kind of went in order. So I just said medicine will begin visit by introducing themselves and other disciplines and then summarize our medical concerns to the patient. We'll then ask the patient if they have any questions or other concerns. Recommendations will be provided to address patients' high BMI, diet, exercise habits, etc. And then we'll hand over conversation to dental. It was medicine. And then dental after. Inform the patient on checking on periodontal status and pain and sensitivity in left lower jaw. Address rescheduling tooth extraction visit since it was delayed due to high blood pressure. In parentheses, medicine will address BP control. And then educate patient on the importance of flossing daily to prevent discomfort and bleeding of gums. We'll hand conversation over to social work. Does that sound good, Shane? Like
that sounds good. Yeah, it's good.
Okay. And then for social work, Malak, like you said, you had plenty of things to address, but I just kind of made it generic. We'll address patients' difficulty in finding a dental clinic due to insurance and cost constraints, discuss patients' disengagement with things that bring them joy since the pandemic, ask about home life and spouse relationship, provide referrals or recommendations regarding these concerns, and then we'll close up the conversation. Does that kind of sound good, like the order of it?
That sounds good.
Yeah, thank you so much for writing that up.
Yes, that sounds good.
Yeah, that sounds good.
Do you guys want to quickly just fill in the recommendations? I know we talked about a lot of them.
Yeah.
just like
And
adamant.
is it possible afterwards to share it with us? I know like we're a bit.
Yeah, I'm trying to.
Yes.
But I'll send it to all you guys, and you can. Hopefully, I'll find a way to share it so you can all just like edit everything.
Yeah, you can email it to like, if that's easier, just like drag it into an email.
Yeah.
Once, yeah, right before we want to start.
All right. Cool. Okay, so I had a couple things here. So okay, I guess starting with number 1, periodontal status and the teeth extractions. Shane, what exactly did you say? Like, how are you like address the pain and the teeth, and then?
Okay, so for the tooth that's fractured, we need to like get an X-ray of the tooth, and then we need to test the tooth, see if it's like still a vital tooth, if it's not dead or whatever's going on with it. Then we get to test like the tooth, like the bone below the tooth. So we need to test the tooth and get an X-ray of it, and then we can treat it with either extraction, or and if it's fine, no treatment. If it needs to be extracted, or if it needs it can still survive and have a root canal, or like it can still be be retained in her arch, and then she can get a root canal and a crown. So that'd be the options for that. So basically, that's the options if depending on if the tooth's fractured or not. And then for her periodontitis, she needs to find a clinic that will that she can go to for regular recalls, because she's gonna experience more bone loss, and then her teeth are gonna start feeling like they're gonna get more mobile, and so she needs to get her regular cleanings. It's like more of a severe type of situation, so she needs to get like a surgical. It's called a scaling and root planing. It's like a more like thorough cleaning.
Okay.
And that's pretty much those two things. She did mention something about her blood pressure, and she couldn't get the extractions last time.
Mm-hmm.
Her blood pressure is better now. Technically, we could treat her under that blood pressure, but if you guys want to address like her blood pressure so that she can maybe go to the dental clinic, I don't know if that's dental anxiety or if that's like her her uncontrolled hypertension.
Mm-hmm. Okay, cool.
So yeah.
All right, so I kind of just said a few things. So address the pain in teeth and lower jaw, test tooth flesh x-ray to see if it's infected to assess for root canal, and then refer to clinic for regular cleanings and maintenance.
Yeah.
Okay.
Well, yeah, whatever clinic that we refer her to, we'll do all those things, but like she needs to,
Okay. Just like limiting me, so I can't like put everything.
And then we can talk about with Malek, we can talk about like the clinic, and like I can help like find that clinic. Talk about the school.
Yeah, I was gonna say like, for instance, like we could have mentioned. Can you guys hear me?
Hmm?
Okay. So like I know I mentioned about the support system. So like, is an issue the access transportation to going to these clinics? So they, asking is there somebody that can take her or not? As well as I know that she also, like I said, mentioned her spouse. Like, is he involved in any way when it comes to her health issues, or is he willing to support her in any way? And I know if we do put her on some type of treatment plan, for instance, in terms of her with the diabetes and other issues that she faces, maybe if since her husband faces the same thing, he can maybe be incorporated as well to offer her support, and that, therefore, like she'll be able maybe a bit more motivated to do these things. As well as I remember Tara, she had mentioned that there's also like kind of like free active things that she can do online. So is there access to that technology? And if not, then maybe we can find something that's in person. But then again, the access to transportation, I think something I need to ask first before we can determine that. And then the mental health screenings as well, we can also ask about those struggles as well.
Okay, so
there's also a social worker at the dental school. I think there's a couple of them. So if you could like connect her with a social worker like at the dental school that could like help with transportation. They also do that too. So if you wanted to talk about that, you can.
Transportation. Okay. Malak, so I put for number 3, like it's categorized under mental health. I can't really put every single thing that you mentioned, but I just said address mental health concerns, ask about spouse and children relationship, provide resources for food and exercise access, and transportation. Is that
perfect? Right? Yeah, that's good.
Transportation. Okay. You can just add whatever you want if you want later. Okay, then number 4 was hypertension and diabetes control. So I think that's Tara, that's where we kind of come in.
Yeah, I think the diet and exercise we should mention will hopefully help with that, the control and weight loss. And then it's still uncontrolled with like weight loss. I don't know. They're already on metformin and sitagliptin.
Yeah.
Maybe increasing the metformin dose, but
Do you guys see this
Yeah.
PowerPoint that like talked about like the introduction stuff? I don't know who wants to start that off and like ask the patient's like name, date of birth, location, and like tell them like your like did you guys see that?
Yeah, I know what you're talking about. I don't mind doing that. But so that would follow after the introduction, I believe, after you introduce us, and then somebody would have to.
After we each
give me
introduce
one.
ourselves? Okay.
Yeah, after we do that, then we would ask. So we'd confirm the patient. We'd ask for the name, the date of birth, and location, and like where are they doing this call from, and are they in a safe and private area to be able to do the call. And then we also speak about the confidentiality and privacy statement. So I don't mind doing those once we do the introduction.
That works.
Sure.
thank you.
So we'll go introduce ourselves first, then you'll do that.
Yeah.
Okay.
Okay, do you want me to like, then maybe I can just like introduce all the disciplines, their names, then you can just jump in and do that? And then,
Sure.
Do you want medicine to start like addressing all the health concerns and then we just go medicine, dental, social work like that?
Yeah, that would make sense more.
Okay.
So the flow can be easier than like abruptly stopping in between.
Okay, cool. So yeah, Tara, we said diet and exercise management, check medication. We'll just like ask about like the metformin and she's taking amlodipine.
Yeah, and maybe like more consistency with blood pressure checks
Yeah.
and blood sugar as well. Wait, is this one? Yeah, blood sugar and blood pressure.
Yes, blood pressure. And okay. And then last thing is high cholesterol. So
Yeah.
I put possibly increase statin dose, add concurrent medication. We can do like maybe like a specific one of the specific meds to target the LDLs and the triglycerides because there's like many of those we can add. So if she's interested in that, we can talk about it. And then also that's lifestyle changes with diet and exercise too.
Yeah, perfect. Thank you.
Yeah, of course. Okay.
So also there's a closing. Do you want to do that one as well? Like the asking if they have any questions, the patient, because I know we are supposed to ask questions too. So I'll probably have some questions related to mine. You guys have some questions related to yours?
Yeah, so we can do that. And then we'd also have to say about the I would end it off as well about asking us how would you like to receive the like summary of the visit. So I don't mind doing that. Wait, just to be clear, so once we introduce ourselves, is it going to be like you first and then one at a time, and then or each of us gonna introduce ourselves, our concerns, and then go from there, then ask the patient?
I think maybe just like I can start off by introducing myself and my discipline and then introducing all of you guys and what disciplines you're with. And then I can hand it over to you and you can do like the whole name, date of birth, or where are you type of questions. Then medicine can jump in with all of our concerns, then dental, then social work. So and then you can wrap up the visit. And then open-ended questions like, do you have any other concerns that we didn't address or whatever? And all of us can ask questions as we go.
Yeah.
But just kind of like
making sure. Okay.
Okay. Cool. So I think we're all set. I'm gonna see if there's a way I can send this in the chat so you guys can just see it. Or you know what? Let me just email it. That's probably.
And you'll say like the next steps too, right? With your summary, like telling them like go send them a summary. It says like tell them some like next steps, like you'll be in contact with them to coordinate their transportation or whatever, or whatever like things you suggest.
Okay.
Yeah. You're closing, right?
Me?
Yeah, you're doing like the closing, right?
It doesn't matter if either one of us can do it. Do you want to do it,
Yeah,
Malik, or do you want
whoever
to take it?
does should just make sure to hit all those points that's in.
If you want, Shane, you can do the closing, and then I'll just ask towards the end, how would you like to receive the visit summary? Just to be able to put it out, if that helps.
And thank them for like their time and stuff.
Yeah.
Okay. Yeah, I'll just ask them if they have questions. I'll discuss any resources we talked about, and then explain like how we'll be in contact with them.
Okay. I just emailed the agenda to all of you guys, so let me know if you can open it, okay?
And I think you can ask the language they prefer to communicate in too, something like that.
What was that?
I'm going to.
Yeah, we have to ask also for the language preference. So that would also fall in with the date of birth and the location and so on. So
Okay.
actually wait, Diana, is that how you pronounce your name?
Yeah, Tiana.
So once you introduce everybody, or once you're before you introduce everybody, let's say you introduce yourself first, just before you continue, you can ask what is your language preference, and then I'm sure it's gonna be,
No.
I hope it's English, but
You know what, Malak? I think for like the flow of things, instead of me just starting, because I was gonna start the visit, but it sounds like you know more about like all those type of questions. Why don't you just like introduce us as the disciplines, and then you can just like ask those questions and then hand it to medicine. So it's like back and forth, you know?
let me make sure I pronounce your name right. Okay, so it's Diana, you are one of the first medical students.
Yeah,
Tara, you're the second medical student, and then Shane, you're the dentist student here, and then I'm the social worker here. Okay, I'm a social work student. Should I say student or should I just say like professional and that's it? I mean, it's for
Student
credentials.
works.
I'm not sure.
Doesn't matter. Yeah, you can do student. It doesn't really.
Yeah.
Okay.
Wait, can you guys see the document I sent, by the way?
Yeah, I just opened it. It's all good for
Okay.
me.
Yeah.
Okay, Tara, specifically with us because we're splitting medicine.
Yeah.
Is there something specific like you just want to discuss?
I think we need to get started, right? Because the time kind of starts now.
Yeah, we can get started. No, there's nothing specific. If you want to like designate now, or you can just run through whatever you want and then I'll pick up whatever's left.
Okay. Okay, sounds good. Yeah, I'll probably just start off with like the obesity related things and then like the hypertension, diabetes, and then you can just add on to the hypertension, diabetes, and the cholesterol.
Okay, sounds good.
All right. I think we're ready then.
Yeah.
Sounds good.
Okay.
Okay. She's in the call, right?
I think so.
Yeah, she's here.
Are you ready to begin?
Yes.
Yeah.
All right. Good afternoon.
Good afternoon.
Good afternoon.
Okay, so hello, nice to meet you today. Thank you for joining us. My name is Medak, and I'm the social worker serving on this team. I, along with this
I'm
team,
sorry,
will be here-
your voice is somewhat muffled. I'm not understanding you.
Can you hear me better now?
Much better. Yes, thank you.
Okay, so we're just gonna go ahead and start again. So my name is Menak, and I'm the social work student here serving on this team. Me, along with this team, will be here to assess how to best support you in receiving resources and services that fit your needs. And we'll work together to come up with a plan that fits your circumstances, okay? Just before we begin, I'd love to confirm your name, as well as your date of birth and location,
Oh,
as
I'm
well as your
Courtney
language
Grimes,
preference.
and date of birth 11/4/59, and I'm in Detroit. My language preference is English.
And are you in a safe area where you can speak openly and privately with us?
I am.
Okay. And just one more thing. So we just want you to know that everything that that's being discussed today will be kept confidential. In addition, the technology we're using is HIPAA compliant and encrypted. So all information is protected and private, and we're not recording this visit. So everything that is mentioned today is safe, and just please feel comfortable to discuss your concerns with us.
All right, thank you.
And part of this team, we have Tara, who is one of the medical students, as well as Deanna. And Shane is our dentist student here joining us today.
All right, thank you.
We will begin.
I think you're muted.
I think you're muted.
Sorry about that. Hello, my name's Deanna. I'm one of the medical students. How would you like to be
Good to
addressed?
meet you.
Good to meet you too.
Mrs. Grimes is fine.
Mrs. Grimes?
Yes.
Okay. All right. Nice to meet you, Mrs. Grimes. So we had a good look at your chart and your history here, and we see that you're coming back for a visit and you have some chronic medical conditions that we're going to discuss with you today. So I see that you were here about 2 months ago, and we kind of took a look at your blood pressure, your diabetes management, your current BMI, where you stand with exercise and diet, and then also your recent event of a fall, which led to which didn't lead to any fractures, thankfully, or any issues following that. But we see that you have this like worsening jaw pain and teeth pain that one of our dental students is going to address following. But from a medical perspective, there are a few things that we wanted to focus on today. So one of the things we wanted to talk about is I noticed that your last BMI was measured at 38 about 2 months ago, and this is seen to have increased since 2020 during the pandemic. Understandably, it was a very stressful time for a lot of people. A lot of anxiety. People were limited to where they could leave. And I see here that you've been trying to eat a healthier diet, which is great, increasing your vegetables and things like that. And then also it seems like you have been having a lack of motivation to exercise and have some concerns about joining a gym as well. So I guess I just kind of wanted to hear about your concerns regarding that specific thing, and we can kind of address how we can help going further.
Well, I'm especially glad that there's a dental student here because that is really bothering me. As you said, I did go for I went to urgent care and they did tests and x-rays, and they said I didn't break anything. It really felt like I'd broken my jaw. But in any case, even though they said I didn't break anything, it feels as if there's one tooth in this area that it feels like it's loose. And I'm wondering if maybe I did that when my chin hit that coffee table. The reason I'm continuing to worry about it is I'm having a lot of sensitivity to hot and cold foods and beverages that I didn't have before that fall. So perhaps he can talk about that. But you're right. The main thing that I was looking for was the feedback on all those tests that were run and some input about what I need to do. You spoke of my weight gain. I saw an orthopedic surgeon about 6 months ago, and about my knee. And the first thing he said was, I need to lose 25 pounds. And as you can see, instead I've gained, and I don't understand what's going on. My husband and I have made some changes in our diet. Both of us have a problem with weight.
Mm-hmm.
And we have almost completely eliminated red meat from our diets. We're trying to get a lot more vegetables and fruits in, but in the community where we live, it isn't always easy to get fresh vegetables that we like. And that's been a little bit of a challenge. I'm really worried about that because I know that it isn't good for me in general to gain weight. And especially with this knee problem, it's not going to get better until I lose some weight.
Absolutely. Yeah, no, I completely understand your concerns. Um, I think we all have a lot of recommendations regarding, the weight gain and your access to food and exercise and as well as your tooth pain, which has been bothering you. And, especially since the fall, you felt like it's increasing your sensitivity and pain. So we're all going to try our best to address all those things separately. Um, First things first, I guess from like our medical perspective, we can kind of go into our recommendations about some of those things that we are educated in here. So regarding the weight gain, so, like you said, it seems like you've done a good job of increasing your vegetables and decreasing red meats. But as we know, everybody has a different body type, metabolism, and everyone responds to different types of diets. So there are resources we can provide to kind of guide you in other directions if you're interested in that. Also, social work, Malak will be more than happy to discuss your difficulty in accessing specific foods and your budget issues, as well as the concerns for joining a gym. So she will definitely address those things. And I think, the biggest concern for us from a medical perspective is because of the weight gain, it kind of flows into some of the other chronic medical issues that we're looking at today. And so with lifestyle changes and diet habits and exercise changes, we can kind of improve all those conditions and just make you a healthier individual and make you feel better overall. So yeah, so that's that. So if you are interested, we can provide some resources about that and look more into how we can try to follow up with you in maybe a couple months and see if any of those things have helped improve your BMI.
Well, I would be happy to get some help in those areas because obviously I'm not doing the right thing, and I need to get this under control.
Okay, sounds good. We will definitely provide that for you. All right, so next thing we kind of wanted to address here is I noticed that your blood pressure, you've been taking it at home about 4 times per week. You've been averaging about 142/88. And it seems like your ranges are still a little bit on the high side. And I also noticed that you had about 3 to 4 missed doses per month. And I just kind of wanted to ask you if there was anything going on there, something that was preventing you from taking your medication.
Nothing in particular. I just forget to take it some days.
Okay, that's understandable. It's hard to keep up with all the medications. We do recommend keeping a schedule, sometimes a log, writing down when you take your medication so it helps you keep on track. There are also electronic apps that are really great that we recommend to patients that help you keep track of your blood pressure readings, and it's very easy. You just go in there each day and you just log it, and that way you can kind of make sure that you're keeping track of your blood pressure and then as well as taking your medication at a certain time each day. So that's what I would recommend to kind of stay more on top of the blood pressure control. And then on top of that, I think it is really important to enact certain diet changes and exercise habits to help with blood pressure. So something I'm sure you've heard in the past is just controlling your salt intake. That really helps to help control your blood pressure. So salty foods, red meats, which seems like you've already cut out, so I'm sure that's helping. And then also exercise is a great thing to help with blood pressure too. So going for a 20 to 30-minute walk per day can really make a difference in your blood pressure over time. So that's something we really recommend there. And then, yeah, maybe Tara can add a few things about blood pressure and things that she recommends, and as well as the diabetes that we were going to discuss next.
Yeah,
Okay.
absolutely. I just wanted to add on to that. So mentioning the exercise, what is your main concern with the exercise? Is it a lack of motivation, or is it that with the knees, you want to lose weight to help your osteoarthritis, but then it also makes it hard to walk as well and to move and keep active.
You've hit both of them. The motivation for so many things has not been there since really the early part of 2020 when the lockdown with COVID began. A lot of things have gone right out the window that I used to really enjoy doing. Now, I cannot tell you that I really enjoyed doing exercise even before then, but since then, my motivation level in general has been so low. Other things that I enjoy, not so active, but still they were a part of my life and very, very important to me earlier. I just don't have an interest in anymore. I used to love to read. I'd go to the library every week with on a regular basis. I'd get new books. I used my Kindle. I think about it now, but I don't take any action. I enjoy word puzzles, crosswords, and word searches. I have some books still here, but I look at them and don't use them. And regarding exercise, between my knee and my level of fatigue, by the end of the day, that's way down on my list of priorities. But when I leave work, I need to come home and prepare meals. I spend a few minutes, with my husband just for interacting with him and watching TV. I try to be in bed by 9:30. And that's another thing. I often don't get right to sleep. I need to be up at about 5:15. Once I go to sleep, I'm fine, but sometimes getting to sleep is a problem. So exercise is something that I don't even think about.
Yeah, it's understandable with, major life changes. Majority of the world has unfortunately been facing struggles just like you. I do want to ask though, because we do ask all of our patients who have been experiencing things like this, do you ever have thoughts of hurting yourself or wanting to cause harm to yourself during this time?
No, I haven't had that. I just feel sort of blah.
Yeah.
Not really engaged in things that I generally would be.
Right. Absolutely. And I think Malak will touch on this later as well. But if you feel that, this has been a struggle for a couple months now and it's interfering with your day to day and your health, medication is always an option. It's not a permanent thing. I know a lot of patients think like, oh, I'll just be stuck on this medication forever. It's really just something to help you get over the hump so that you can start doing those things that you enjoy, the word puzzles and the reading, and then eventually exercise, hopefully. And once those things become ingrained in your daily lifestyle, coming off of the medication is always an option, absolutely. And yeah, so hopefully we can, you mentioned time is a restraint. You get home from work and you have to cook, but you still want to spend time with your husband. Maybe going on walks with your husband can be a form of, motivating each other. Also being able to spend quality time with one another, but still getting in a little bit of movement and exercise in the afternoon. That could be a possibility. But we hear your concerns. It's been a very tough time, very unprecedented circumstance. So it makes sense that, people and you are reacting in this way. So I'm sorry to hear that, but hopefully we can help you out after this discussion. The last thing medicine wanted to talk about was the cholesterol. So I'm happy to hear that you and your husband have limited red meat because that does help lowering your bad cholesterol, which is called LDL, and incorporating instead healthier fats like avocado, salmon, is going to raise your good cholesterol. So when you take one thing out, you can always substitute with another. outside of that, you're currently on like a statin, cholesterol medication. So if we don't see improvements with the change in your diet, we can always raise that medication or add a secondary one as well.
Well, if I can get some relief from this feeling of just general malaise, I would be very pleased, because it's been more than just a couple of months. This has been going on for more like 3 years. And it feels like it's unending.
Yeah,
And I don't like that feeling.
of course. So at this point, are you open to medication? Is that something that you're considering?
Well, it's especially since you said it might be a temporary thing. I surely don't like piling on more medications, but I need to get something to boost me out of this feeling that I've been having. And if it's possible that I might take it for a short time, I'd be definitely open to that.
Okay. Yes, absolutely. I'm glad to hear that. And with that being said, it was very nice talking to you. I want to hand the conversation off to Shane because I know you're also in a lot of pain and he's going to help with that.
I'll be happy
Hi,
for
I'm
that.
Shane.
Yeah.
Hi,
Hi,
Shane.
nice to meet you. I'm the dental student discussing today. So I just wanted
Okay.
to discuss your obviously most pressing issue would be the pain in your tooth or the area of your tooth. So you said you described it as is it like a chronic pain, or is it a dull pain, or is it a sharp sort of pain? What type of pain is it?
Well, it's more that specific pain that's come since I fell is more
Yes.
related to my drinking or eating hot or cold foods and beverages. The generalized pain that I have had in my gums since, oh goodness, how long ago was 2021? That's the last time I saw a dentist. And at that time, he was speaking about my getting some extensive work done, because I need to have several teeth pulled because of my gum situation. And that is just a sort of ongoing discomfort. Keeps me from doing things that, like, for instance, I don't floss, because when I floss, that hurts really. And it makes my gums bleed. So I stay away from flossing completely.
All right. So I just want to discuss this tooth first, and we'll get on to the other sort of pain you were having. So this tooth
Mhm.
might be fractured, so you'd have to get an X-ray of the tooth. So I'd recommend you obviously to go see a dentist, and we'll discuss options for you regarding accessible dental clinic and a more affordable dental clinic, possibly the school dental clinic, and we'll discuss that in a second. But so you'd probably need an X-ray on this specific tooth because you just had an X-ray on your head and jaw. So those things won't really be very specific to whether the tooth was fractured or if there's like some sort of infection of the tooth that we need to treat. And that's probably what's lending to the sensitivity you're having. So the treatments can range from like you needing some sort of root canal, maybe a crown, or it can be maybe you need that tooth removed, something to that extent. So you really just need to go see a dentist to get those proper evaluation and X-ray for that specific tooth. And then you mentioned your you'd gone to dentist in the past, and then they diagnosed you with periodontitis. Are you familiar with what periodontitis means?
Oh yes, he explained that it had to do with my gum condition deteriorating.
Yes, yes. Yes, the bone of the around your teeth is the supporting structure of your teeth, right? Keeps your teeth stable, and then once that structure on your teeth starts to, it's a form of disease that basically that the bone supporting your teeth starts to um, due to plaque and bacteria in your mouth, it causes inflammation of your gums. So that's a very important issue to get addressed. You'd likely need to go see a hygienist or some sort of dental clinic where they can offer you the service of scaling and root planing. And you need to keep really regular with that because it's a progressive disease and it will continue to progress until you get proper treatment. And only at that point, and you once you've received the proper treatment, it's important that you learn the proper skills at home to keep up your own oral hygiene practice, to make sure you're brushing properly. And you mentioned you had some discomfort flossing and some bleeding, and that should improve as you do it more often and as you go see a hygienist who can clean your teeth properly. Um, that is a more like you need a much more deeper cleaning than a cleaning that you'd normally get maybe if you didn't have that condition. So that's a very important thing to address because you can't really get into those pockets that you have around your teeth with a toothbrush or with a floss. There's deep pockets around your teeth that need to be cleaned properly. Um, and then so that lended itself to like some aching. You mentioned some aching lower left jaw pain. I wanted to just yeah, that sort of pain can be related to either specific teeth, or it can be because you have some sort of inflammation and disease back there that it's causing you pain when you're biting and when you're chewing food. Was that sort of like a pain that you just kind of had constantly, or was it specifically like when you were chewing and eating?
When I either have hot food and beverages, or especially hot, I like tea, and hot tea will aggravate that pain, and cold foods
Yes.
and
So like what happens
beverages.
with that sort of situation is what happens is the bone around your teeth as it resorbs or as it deteriorates, as you said, it that your teeth become much more sensitive because they're exposed more to hot and cold drinks. They're exposed more to to foods you eat. So that's probably lending itself to that. So it's important that you either go see a dentist to maybe properly prescribe you a desensitizing toothpaste or some sort of, or they mentioned that they required extractions. So, and then they said that your blood
That
pressure
was what
wasn't
he
controlled
said.
that day.
Yeah,
So was that related to like some sort of dental anxiety, or did you not take your medications that day? Like what was that related to?
that may have been because I hadn't taken medication that day, because I do forget ever so often to take it. And sometimes it's more than one day in a row, you know. So it could have been medications that I didn't take. But
Okay. Okay. So
you mentioned something about a school clinic or something.
yeah. So you'd mentioned that you were struggling finding a place that would accept your insurance, or that you could
Right.
find coverage for your treatment that
Yes.
you needed. So the school offers lower cost treatment options, and they offer at a lower rate than normal private practices. You could discuss that with them. There's also treatment plan options where you could like possibly pay over a certain period of months, or that sort of thing. So there's other sorts of payment, and there's other lower cost treatments that you could receive at those sorts of clinics. So the dental clinic at Detroit Mercy, which is close to you because you're in Detroit, offers that sort of service, and I'd recommend you seek some service there. And if you can't find it there, there's also University of Michigan, which is like an hour away from you. Has also a dental clinic, and there's other sorts of dental clinics that offer low cost services. Um, I know the Malta Clinic does it, and there's a couple other clinics in Detroit that do it as well. So we can refer you to
Well,
those
I
sorts of
need to.
facilities so you can
Good.
get proper treatment.
Well, I'd appreciate that, because that was a part of my not having followed through with that initial suggestion that I have those teeth pulled, because the places that I called were not accepting my insurance. I don't have one like CAP or Blue Cross Blue Shield or something. It's a small company, and lots of places don't take it. So if I can get a place that is more inexpensive, that'd be good.
Okay, that sounds good. And before I refer you to Malak to discuss any other sorts of concerns she has, I just was wondering if any of these sorts of, obviously you're in pain, and you've had chronic pain from your periodontitis. So I was wondering if maybe those were contributing to your mood and your your overall mental health, and how you're feeling day to day, and if those were like main contributors, or those are just kind of minor contributors, and the greater ones are like more like your sense of like not wanting to do the things you used to do.
Well, it's possible that that pain is sort of unremitting, and maybe that is related to my just not feeling like doing much of anything. I'm tired all the time. I just don't have a lot of interest in many things. You know, it's just going through the motions some days.
Okay, I'll refer it over to Malak.
Okay, thanks for your input.
Thank you.
Thank you so much for joining us. Thank you and for feeling comfortable for sharing with us your struggles. I just want to first start with letting you know you're not the only one that has faced, you can say, mental health struggles during the pandemic and even after. There are many people that are still facing difficulty with socialization and in terms of motivation. And I just want to ask one question to begin. Do you feel that these struggles with disengagement began during the pandemic or before? Or is there something that you feel that has, besides your health impacts right now, that has kind of caused you to disengage from the things that you usually do?
I would think that it probably started with the pandemic when we were unable to do so many things because, as I said, I used to go to the library on a regular basis. Well, of course, at that time, couldn't go to the library. My interaction with my family, my children both live out of town, and all of a sudden I couldn't fly to Atlanta, or my daughter couldn't fly here to visit with us. My son lives in Cleveland, he and his family, and driving back and forth was something that we all used to do pretty often to visit with one another. And then all of a sudden we couldn't. My mom lives not too far from me. And all of a sudden I wasn't seeing her because I work and I didn't want to possibly take an infection to her. She's over 80. So I did not go and visit her like I had been in the habit of. And I think it did start around that time.
I hear your concerns. Thankfully now that we have moved past the pandemic, and although there may be slight restrictions, I definitely think we should work with connecting you more to your family, as well as maybe being able to connect with your children as well. Do you
We are
have,
doing, excuse my interruption, but we are doing better. I am getting back to see mom. I see her now 3 or 4 days a week, and we have visited back and forth with the children.
okay,
So
that's
things
great.
are improving there, thank goodness.
And maybe are you maybe open to, because like I said, you're not the only one that has faced these impacts of the pandemic. Do you feel comfortable with maybe group therapy sessions with people who face similar struggles, or are you maybe more open to personal therapy if that's something that you feel comfortable with?
If it can help to get me out of this feeling of I don't care about doing anything, yes, I'll do that either way.
Okay. And I also wanted to address your or talk about the resources in regards to food, and you said that it's kind of a financial restraint or strain on you and your husband when it comes to nutrition. So do you guys face the issue of not having, let's say, like a market close by and able to receive these vegetables and so on? Or is it a just the only factor is your lack of financial ability to afford it?
It's more a matter of access. We can afford most of the things that we would like, but they just aren't available close by. We'd have to travel quite a ways to get it. And I do that occasionally, but I don't want to do that every week.
Maybe we can look into having it being delivered. Maybe we can speak with somebody within either the market, or we can find some type of resource which offers delivery to your house with the food that you need. I'll definitely look into that with you. And in terms of transportation, and I know because after this, we're going to have to go, quite a bit with following up with the doctors and so on, or with the dentists and other things. Do you have access to transportation?
Yes, yes.
Okay.
I do have a
I
car.
just wanted to make sure. Okay, so that's what I have for now. But I definitely would look into if you are open, we can definitely speak more about mental health and group therapy sessions if that is applicable for you. And we can think about maybe starting maybe new hobbies if those that are old don't interest you no more. We can look into new things and just maybe getting you out and maybe even involving your husband. I know you said that would you say that he's a good support system for you? Do you feel like he understands where you're coming from?
Yes, he does. He's got some of the same issues. As I said, he's got some weight issues and his blood pressure, he has to work to keep under control.
Mhm.
So we share those concerns. And just in general, he is very supportive.
Well, I guess definitely setting, let's say, for instance, a goal per week, like, hey, let's go, maybe do this together. Maybe it'll help with the, like I said, the lack of being able to go out from the past with the pandemic, but now that it's being a bit more open now, we can maybe look into just more group activities and just overall maybe getting you out there a little bit more. We're here to help you.
Well, so far you've offered me some ideas that I hadn't thought of.
Well, I'm glad to be here. Okay.
All right. So we just want to ask you if you had any questions or concerns for us besides the ones we discussed already.
Well, the only one I'd have right now is will I remember all these good suggestions?
Yeah,
We'll
we'll help you with that. Yeah, go ahead.
Well, just to follow up with that, is there a specific way you'd like to receive your summary visit of today, just which covers everything that was discussed so that you can view? It can either be through mail or email or even fax it to you, whichever is easier for you to receive.
Well, if you can email that to me, that would be good. My email should be in my file.
Okay, I got it. Thank you.
Okay, so I just wanted an overview of what we discussed today. We touched upon your medical issues. I don't know if you guys had any specific you guys obviously had some specific recommendations, but any ones you want to emphasize or like summarize again? Either one of you guys, Tara or Deanna?
Yeah, sure. So yeah, today we kind of discussed several of your chronic health issues. So your BMI and kind of some recommendations for weight loss and lifestyle changes for diet and exercise and how that can also improve your blood pressure and your diabetes, as well as your cholesterol. So they're all pretty much interconnected. And so we can focus on getting the lifestyle changes in balance. And then when you follow up with us soon, we can see if we need to adjust any medications, increase any doses, add any medications. And that would be pretty much my recommendation from that point of view.
All right, and then I had some recommendations regarding we're going to get you in contact with a dental clinic and get you hopefully scheduled for a visit very soon so you can receive regular treatment, get that emergency treatment or the treatment that after the fall you'd experienced, and get that tooth probably treated as soon as possible. And then also Malak had some recommendations, and she'll also help with getting you in contact with a dental clinic that can help with your insurance and that sort of thing. And we'll contact you to schedule another appointment to follow up and make sure that all our concerns that we discussed today were addressed. And then I think, go ahead, Malak. You mentioned you were going to give her the summary of our visit today. And then we discussed if you had any other concerns. And I think we're all set.
Well, I thank you for all of your input. You've given me some hope that maybe some things can get resolved here.
And thank you so much for your time
Yes.
and for joining us and allowing us to be able to help you today. And just before we close this off, is there anything else that you'd like to mention before we end this call?
Nothing else comes to mind right now. Mm-mm.
So yeah, each of us will, like I said, we mentioned we'll hopefully maybe come up with a plan to be able to something that's realistic as well with your work schedule and being able to include as well some leisure time and to be able to maybe begin, like I said, some hobbies and some fitness activities that are also realistic for you. And but first and foremost, definitely the dental issues. Like Shane said, we will probably do a follow-up and get you connected to a dentist that is affordable for you as well that fits within your insurance. And if not, we can definitely look into more insurances for you that provide more services. And as well as the mental health struggles where the opportunity to be able to do group therapy sessions is definitely open. And we can definitely speak more about that individually if that's more later on or to another session. And what else? Is there anything else that I've missed?
Nope. I just want to thank her for her time today.
Yeah.
Right, thank you so much.
All right, thank you.
Thank you.
Take care. Bye-bye.
Okay.
I
Guys.
think we did good.
Yeah, good
That was good, I
job.
think.
Yeah, I think it went well. Okay, cool. So I think like, I don't know if you guys have access to the Canvas page, but
Mhm.
so we submit the visit agenda that we just made, and then there's also another couple things that we have to do and submit, I think by like the 26th or something.
Yeah, there's an assignment too as well. So it's the give me one moment, I can pull it up. It's the patient care plan.
Yeah.
So basically, I guess it goes over some of the things that we discussed and what are the strategies that we're gonna think about for the patient.
Yep, and then there's also a reflection response too.
Mm-hmm.
So let me see what the patient care plan is. Oh, it's
Is that
essentially
the
like everything we
Assignment
did.
2, what is that separate?
Yeah, they're two different assignments. So assignment one, I believe, I don't know when that is due. If we're supposed to submit it right after this meeting, but they both each are doing like only one of us should submit it per team.
So on our end, like from our Canvas page, it shows that like you submit everything together, like in one
Okay.
document. So the visit agenda is included, and then there's the patient care plan, and then the reflection. So there's 3 parts of the assignment.
Mhm.
Or assignment 1?
Yeah, it's like just one submission for the whole team.
Oh, okay.
So
Do you want to
yeah,
discuss the patient care plan, or do you want to do that just on our own time?
And when do we have until the 25th, you said?
I think
Let me
it's
check.
26.
Yeah.
We can like upload this onto Outlook as like a collaborative thing, and then everyone can fill it out on their own time if we don't want to do it now. But up to you guys. I have time.
I think it's a good idea. We can
Yeah,
just-
because I do have class within like 15 minutes, so
Oh,
otherwise I'd really like to stay and complete it now, but if whatever works for you guys as
yeah.
well.
That sounds good.
Here, let me see. I can drag it in.
I don't think there was anything really that new. I don't know if she added very much to the case that much. Like, she kind of stuck to the
Yeah.
Yeah, I think
case
there
pretty
wasn't
well.
anything new.
Nothing really. More like she focused on her mental health. I feel like more discussing it. So
Definitely. She said it's been about 3 years now, so it's like that's something that should definitely also be of high concern right now. But I'm glad that she has more connection with her children, so that's a good thing.
Mhm.
I'm
Yeah.
trying to create. Oh, you can only upload here. It's not letting me drop it into my Word, PowerPoint, Excel.
Yeah, these documents are weird. The ones that like you fill them out because I don't know. It's like I don't know what type of document it is. It's hard to.
Yeah.
If they had just done it on a Word document, it would have been easier than all
Yeah.
this because it gets weird.
Mm-hmm.
yeah, like copied everything over and over again, right?
Do you guys want, maybe we can email them and ask, or the person that did the orientation meeting, we can ask if it's okay that we can kind of like transfer this information to a Word document rather than submit it this way, but still have the same information, but up to you guys as well. If it's easier to fill out all at once.
Yeah, I'm trying to. I can convert it to a JPEG, but not a
So you
Word.
completely filled out the pre-visit part, right?
The visit agenda, yeah.
Visit
So that-
agenda, yeah, the visit agenda.
yeah, that's the one I emailed to all of you guys. That one's pretty much done.
I mean, if it copies it over and over again, honestly, like it's gonna do that to everyone. So
Yeah. It's
Yeah,
gonna be-
yeah.
'cause they did that on my end too. So I think we'll just go with it.
Yeah. I think it's fine. I don't think they're like gonna be too picky about it, but
Yeah, I don't think so.
you know what I noticed, guys? This is like super random, but like at the very end of the patient case, there was like a set of lab values.
Yeah.
Yeah, and like at the very end, it just said like urine albumin creatinine ratio was 187, which is
Mhm.
really high.
Mhm.
Saw that, Tara, and then it was like one like
Oh my
since
God, totally missed that.
I know I like just saw that and then I was like, oh shoot. She didn't mention anything about it because that just indicates like there's something wrong with the kidneys. So it could be her high blood pressure, it could be related to her diabetes. Like I guess we kind of addressed that, but like it's just
Yeah.
something I noticed after. I'm like,
There's
oh.
also an NSAID, so I don't know.
Yeah, I think that's a contraindication actually because you're taking
Yeah.
that much naproxen and like it has some issues with I think like the amlodipine and stuff. I think so. Whatever, we addressed the blood pressure
We
and
can
stuff.
address it in like our treatment plan options if we just
Yeah.
we'll just say that like we're gonna emphasize and follow appointment this issue.
Mm-hmm.
Yeah.
Sounds good.
Trying to like copy paste it, but then it gets misformatted as well into like a Word document.
Let
Let's see.
me see if I can try. I guess like worst case scenario, what we could do if we're gonna do it on our own time is just like each of us fill out like what we would put and then we just like send it to one person and then one person just kind of like fills it out with the rest of the stuff.
Would you mind if we maybe sent it to you since you filled out the first one? Maybe
Yeah.
we can each do it individually and then we can send you what we wrote and then
Yeah.
you can go from there. I think it's
That
the
works.
best option right now.
Yeah, we
But
can
thank you,
email
Tara,
that
for
part.
trying to figure it out.
Yeah, it's like okay, like it's really misformatted, but I feel like it's like it'll get the job done, and then maybe someone can copy paste it into something else. But I'll send it.
Okay.
anyway.
See if we can open it then.
Yeah.
Does email work for you guys fine, or would you guys want to maybe exchange numbers or anything?
Yeah.
Okay.
Numbers is good for me. Just
Okay. Would you guys want to maybe do an iMessage or WhatsApp?
iMessage works.
iMessage is fine for me.
Yeah.
Just type our numbers in the chat.
Yeah, go ahead. I'll make the group.
Okay.
this is also the link. Are we putting our numbers in the chat?
Yeah. I'm gonna go ahead and make the group.
Okay. Well, it kind of like stretched everything out.
Yeah. I'm trying
I
to.
didn't really know if we're supposed to be guiding the patient to like answer our questions instead of letting them talk like the whole time, or what we were supposed to do. Because like in real life, you know how you're supposed to like guide their responses.
Yeah, it was definitely weird. I
So
agree.
I don't know how to do that. Because she started answering dental stuff when you were speaking about medical stuff. So I was
Yeah,
like,
like in the
like-
beginning.
I don't know how this works, but
Yeah.
Sometimes what the patients will do, like in these like type of controlled settings, is they'll want them to talk about their main concern first. So once she started talking about like the dental issues, I was
okay.
like, shoot, we probably should have started with
I know,
dental.
I was thinking that too, but it's okay.
He was nice about it, and I just because I didn't want to just like be like, all right, well, anyways, so about obesity and
Yeah.
go into it.
Yeah.
Yeah, we just kind of like went in order. I think it was fine, but
Yeah, it's fine.
yeah. Okay, so Tara, is this document like we can all edit this? And it'll
Did you
Yeah.
guys get the message?
Are you able to edit?
I think so. I'm just gonna write my name at the top. Tell me if you see it.
Yeah, I see it.
Okay, cool. So I guess we can like just try to put it in here. If it's difficult, honestly, if you if you don't want to like format everything, like you guys can just fill it out and send it to me, and I don't mind like copying it down. Whatever's easier for you guys.
Yeah, we can email it. That works too. You can copy it from the email.
Yeah, I don't mind.
Oh, yeah. Yeah, this is kind of like a mess.
Yeah, we'll just do that.
Okay.
Tara, don't worry
It
about
makes
it.
it easier on you. Sorry, you've
Um,
been trying to get it.
Yeah. So, okay, you guys can just kind of like we have plenty of time, but whenever you guys want to send it over, feel free.
There's like a survey.
No,
we
I
always
just
do.
like expanded it, made it bigger. Okay.
I
Okay.
haven't gotten the message yet, though.
I definitely put your number in wrong. I'm sorry. Take me a second.
Oh, I should have separated it.
Oh, I got the text.
Are you guys all from Michigan?
I'm from,
Yeah.
Nice.
What about you guys?
I'm from California.
nice. Yeah, I'm from Michigan. So yeah, so then you guys can just send it over whenever you can get to it, and then also there's a reflection.
Yes.
So I guess
I think everybody should get the message by now. I hope.
Yes. Thank
Okay,
you so much.
Are you guys
Yeah.
both second years? Are you guys different
Hmm?
years? Are you guys both the same year? Same
Yeah.
class?
yeah, we're about to start third year.
Yeah.
Are you guys both from California or just you, Tara?
No, just me.
Oh, okay.
No,
I'm
she's
pretty sure it's me. I don't know. Are you in California?
No, I'm not. The weather is not California.
Yeah, the weather here has been pretty bad, but nothing like that bad. Like for California bad.
Weather in Michigan is something else. I'm just saying that. So,
Yeah. Yeah, it's absolutely insane.
so are you guys all like? What's you guys' standing right now? Because I'm a junior right now in social work. Like, no experience whatsoever. So when they threw us into this, we're like, what is going on?
Is that like is it like its own program, or is that like after undergrad?
Right now it's undergrad.
I'm
So like
you're
since
an
next year.
undergrad?
Yeah, I'm in my undergrad.
You're an undergrad, and they're making you do this? That's kind of nuts.
Girl, you think? Like next year we have our internship, and that's when we will actually have a hands-on experience. But as of now, unless you've had some type of personal social work experience, this is like the first like team and like case study. Like we've done case studies before, but not like with different people in different professions. And they're like, these people are coming in, they know what they're doing, and they've done an experience. We're over here just basic education.
Yeah, college
But
is like
it's a good experience. It's not. It went fine.
A really good job though. Like you sounded like you really knew what you were
Yeah,
doing.
good job. Y'all did a
Yeah,
good
Thank
job.
you guys. No, it was really nice having you guys as well. Thank you guys.
Yeah.
But yeah,
Dang, that's crazy.
I know. We were in shock too. We're like, are you like, are they all the same standing? She's like, no, they're going to be all, different. I was like, thanks. Make it look like we don't know what we're doing. But yeah.
Sounds
Okay,
like you've been
then.
doing this for a while.
how do you want to
so-
fill out the recommendations? Should I could copy paste it here so we can have it on the document, or the reflection, not the recommendations, the reflection.
I didn't even know we had to do a reflection, but I do know about the other.
Yeah.
You just want to like put it in that document so we can just like add to it.
Yeah, I added it to the top. Maybe each person can pick a bullet and write something.
Okay, cool. That sounds good.
What is it? Sorry.
It's a reflection.
Oh, we have to do
Oh,
it
okay.
combined reflection or is it individual?
I think it's combined.
Yeah, it's just for the one submission.
Oh, okay.
Do you think we have to like write like a paragraph each of the bullets, or it has to be? Yeah, probably
Did you
like
put that in
a
chat
paragraph.
or did you send it to us? Or did you share it? How'd you share it?
I
Yeah,
shared
it's in the
it at
chat.
the top of that document that I sent.
I'll definitely be done by today, but, all right.
Okay.
I don't know if you can see it. I think maybe under each bullet, like everyone can pick a bullet and write like a small paragraph for
I
that
think because
bullet.
you're sharing it through Wayne. Are you guys all Wayne students?
Yeah.
Yeah.
You know.
Yeah.
Yeah,
Let me see if it'll let me because I do technically have a Wayne account. So
Oh, I thought I found you.
You don't have a
technically I
Wayne
do
State
have a
account?
Wayne account, but I don't know. I don't use it that much. So I don't know how to get. Do I have to log into my Wayne account then do it?
Yeah,
Yeah,
you would need to log in to be able to access the document.
but I sent the link in the chat. So if you click on the link, it should just like make you log in right away to access it. I don't know
yeah.
if that works better. Maybe.
Oh, okay, I see. So this is not gonna disappear when we're done. There.
Oh, we lost him.
Where did he go? Okay, so all we have left to do is the reflection, and then we have the care plan. So each of us would put in our sense. So whatever we said, we'll go ahead and put that in there.
Mhm.
And then the bottom, it says healthcare disparity. So when we'd say food insecurity, we can say maybe lack of access to food. I'll mention that. And then what else is the healthcare disparity? What like the lack of coverage for insurance for her dental health issues,
Yeah, for sure.
right?
Yeah.
Okay, cool.
The food
Okay.
insecurity was put there from before, so I guess we can just change the bullets.
Okay, that's why I was
Right.
confused. I wasn't
Yeah,
sure.
that's like an example. Whatever's in gray is an example.
Yeah. Okay, cool. That sounds good. And then
I don't know why it exited me out when I
Yeah.
did that.
Problem.
Let me try one more time.
and then yeah, for the reflection, we can just each pick a bullet point and then just like 2 or 3.
Do you guys just want to choose it right now, so before we leave, so we don't like have to go through it again? 1 second.
Sure.
For the bullet
Okay, let
point
me try
part.
this.
I can
I
do,
really don't mind doing any of them, honestly.
I could do the last one. I'll just put my name there.
I can do the first one.
Is there a survey or something we gotta do too?
Yes.
Yeah, I think you do that.
We have to do it.
There.
There's a post survey.
Yeah,
Yeah.
there's a post-visit survey that you should get access to. You just fill it out on your own.
Okay. It's in Canva, right? I mean Canvas.
Mm-hmm.
Okay.
It says your sign-in was successful, but you don't have permission to access this resource. So I don't know if it's because my account's limited and what I could do on.
I'm gonna. Do you want maybe to just write it right? Oh, you don't have access to it. Would you want to maybe like send it to us, or like we can just include it if you don't have access to it? It's fine. It's
you
not a
have
big deal.
Yeah.
Yeah.
Or you,
Just send
do
me
you
a
have-
picture of it and then I can like fill out whatever I need to fill out and you guys can put it in there.
We'll send a screenshot in the message group that we made, and then you can go ahead and type what your recommendations were. And
Yeah,
the
okay. And I'll email
okay.
it to either one. I don't know who wants to submit it, but
I think
I'll
we said
do it. Yeah, you got whatever is easier for you guys, like how you fill it out. Just you can send it to me. However, I'll find a way to just put it in the original document and submit everything. So
okay.
Okay.
So I'll give this one
I'll
to Shane.
go ahead and just
yeah.
that works.
okay. Okay, Shane, I'll send I guess the screenshots of what it is, or just what for you to answer, and then we should be done. Oh, wait, so
good.
we said for the reflection portion, we said each of us will choose something. So okay, did you write your name, or was that Tara?
I did
Oh.
it so that you can
So
just
you're
screen.
gonna explain any barriers that hinder the team for accomplishing the visit agenda, but I'll send that in the group. Okay. All right. It was nice meeting you guys.
Yeah, great
Nice.
work.
We'll talk soon if needed. Bye bye.
Okay, sounds good. Bye, guys.
Bye, guys.